My patient is presenting to the clinic with cuboid syndrome. She is a frequent runner, and what we're finding is point tenderness specifically. It's a little bit diffuse, but it's over the cuboid region. Now, um, what we know is that there might be some discongruency in between the arthrokinematics of the calcaneal cuboid joint. So I'm going to apply a high velocity thrust technique called the Cuboid Whip to hopefully decrease pain and place the cuboid back in its correct position. So essentially what I want to do is find the anatomical location of the cuboid. My patient is in the prone position, and what I'm going to do is bring the knee into flexion like so. Now to find the cuboid, I am going to follow the fifth metatarsal. I'm going to go to the fifth met head, which is right here, and I'm going to follow that down into the cuboid groove. And now we're going to be into a lot of soft tissue here, but directly below that is the cuboid. So now I'm going to apply pressure to that area, and I want to apply a significant amount of pressure because there's a lot of soft tissue here, like I just said. So when I apply this thrust, I'll place my thumb on the one thumb on the cuboid, I'll place my other thumb over top of that thumb. Okay, I grasp the dorsum of the foot, and what I'm going to do is I start with the knee in flexion, and I'm going to extend the knee. I'm going to internally rotate the leg like so. So you want to make sure your patient has an internal rotation, or at least a little bit. And then I'm going to bring the foot into plantar flexion. So this is the motion that I'm going to apply my manip. I want to take out all the slack, and at the end I'm going to apply that thrust. So I start here, have your patient try to relax, and you apply a whip. Now, you're looking for a cavitation. You don't necessarily have to have a cavitation for the treatment to be successful. However, I am going to immediately reassess by hoping to have a decrease in pain in that region of the foot. You can also use other types of conservative therapy, such as bracing or orthotics for this syndrome.